Have you ever walked into a room and just been hit by a smell? Not just, oh, I don't like that, but a real, almost physical reaction.
Yeah, absolutely. That kind of intense experience is actually what we're exploring today.
Right. It's a topic that maybe doesn't get a lot of airtime.
Hmm.
Osmophobia.
Exactly, osmophobia.
Okay.
And at its core, it's really more than just a strong dislike. We're talking about a fear or real aversion, sometimes a psychological hypersensitivity to odors.
Mm.
It can genuinely impact someone's day-to-day life.
Okay. Osmophobia. Sounds quite clinical. Let's break that word down. It's got roots in older languages, hasn't it?
It does, yeah. It comes from Greek. You've got osmen, O-S-M-E, accent on the E, which means smell or odor.
Okay, osmo.
And then phobos, which most people probably recognize means fear.
Right, like in other phobias.
Precisely. Now, you might also hear another term, olfactophobia.
Olfactophobia.
Yeah, that one uses the Latin root olfacto, which means to smell at. So different roots, Greek and Latin.
But basically the same thing.
Essentially, yes. Both point to this marked sensitivity or even fear related to smells.
So it's definitely a real thing, not just being fussy about smells. Now, what really jumped out from the sources we looked at was this strong link between osmophobia and migraines.
Oh, absolutely. That connection is, well, it's quite striking.
Tell us more about that.
Well, it's reported really frequently by people who suffer from chronic migraines. Often, it's a pretty consistent part of their whole medical history with migraines.
Consistent. So not just a one-off.
Not usually, no. In fact, researchers are actually looking into whether osmophobia, its presence, and maybe its severity, could help differentiate chronic migraines from other kinds of headaches.
Like tension headache.
Exactly, like episodic tension-type headaches. We definitely need more research there, but the correlation itself is pretty strong.
Wow. So it's not just like a side effect. It seems really woven into the migraine experience for some people.
It really seems that way.
And we found a statistic on that, didn't we? About how many people with migraines are affected.
We did. It was quite surprising, actually. One study suggested that up to 25%, a quarter of people who experience migraines, also report having some degree of osmophobia.
25%. That's a lot.
It really is. Think about that. 1 in 4 migraine sufferers. It puts into perspective how challenging the world can be when so many everyday smells, things others don't even notice, could be triggers.
Yeah, I mean, things like walking through a department store perfume section or public transport, certain foods cooking.
Exactly. All potential triggers for discomfort or even full-blown pain. It can be incredibly disruptive.
And our sources also mentioned it's not only tied to migraines, though that link is strong.
That's a really important clarification, yeah. While the migraine connection is probably the most studied, osmophobia has been seen in other situations too.
Like what?
One specific example mentioned was opioid withdrawal syndrome.
Oh, okay. How does it manifest there?
Well, in that context, it often shows up alongside nausea and vomiting, which, suggests it's tied into some complex physiological responses, not purely a psychological fear.
Right, so there's a real physical component potentially linking the sense of smell with, say, the digestive system or stress responses.
It certainly highlights that, yes. It shows that this sensitivity isn't always just in the mind, so to speak. There can be very real, very physical reactions involved.
Okay, so this really drives home that osmophobia is, it's much more than just having a sensitive nose or being picky.
Definitely.
So for you listening, as we sort of pull these threads together in this deep dive, what's the main thing to understand about osmophobia?
I think the core message is that osmophobia is, well, it's real. It's a genuine sensitivity to smells, and it can be quite impactful for those who experience it.
And the key links.
The link with chronic migraines is probably the most prominent one we discussed, affecting a, surprisingly large number of sufferers.
Up to 25%.
Right. But it's also crucial to remember it can show up in other conditions too. And the experience itself isn't just disliking a smell. It can really range from a strong aversion all the way to triggering physical symptoms.
Okay, so we've covered what it is, the name, the connections, particularly migraines. Let's just recap the absolute must-know points as we wrap up.
Sure. The critical things are, 1, osmophobia is a real hypersensitivity to odors, not just preference. 2, it's frequently linked with chronic migraines, which is a major aspect for many patients and for research. 3, it's not only migraines, it can appear in other contexts. And 4, the impact can be significant, sometimes acting as a trigger or making existing symptoms worse.
In that migraine relationship feels really key to emphasize, doesn't it?
Absolutely. For a lot of people with migraines, these odor-triggered attacks are a huge part of their experience.
And is it always like Bad smells,
Hmm.
cleaning products, strong chemicals.
Often, yes, strong or unpleasant smells are common triggers. But sometimes, for some people, the sensitivity can become much broader. It might extend to smells that most people find neutral or even pleasant.
Wow, that makes managing it even harder, I imagine.
Incredibly challenging, yeah.
So, for you listening now, if maybe this sounds familiar, either for yourself or someone you know, these really strong negative reactions to smells, maybe connected to headaches or other physical feelings, what's the takeaway?
I think the main takeaway is don't dismiss it. It's definitely something worth mentioning to a doctor or healthcare professional.
Right.
Recognizing osmophobia, understanding it might be a factor, could actually be a really valuable piece of the puzzle in managing health issues better. Especially, recurring headaches are part of the picture.
It's about spotting those potential triggers.
Exactly. And seeing how these sensory experiences might be interconnected with other physical things going on.
That's such a good point. Connecting experiences we might otherwise just brush off. Smells, sensitivities,
Yeah.
with our broader health. It really makes you stop and think, doesn't it?
It really does. Our sense of smell, we probably take it for granted most of the time.
For sure.
But conditions like osmophobia, they really shed light on just how profoundly our senses, maybe especially smell, are tied into our overall well-being. It's a pretty intricate connection.